Coming of Age is coming up next. I'm your host, Emily Echeverria. First up today, we're discussing back and neck pain and how to know when these common complaints need to be treated by a physician. Next up, we're checking in with the University of West Florida's Leisure Learning Program and its many offerings for lifelong learners. Lastly, we're feeling festive with a craft demonstration with our good friend Kenny Holt from TLC Caregivers. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. Back pain alone is the leading cause of disability worldwide and is a $100 billion annual financial burden in the United States. Here today to talk with us about the signs, symptoms, and treatment of back and neck pain is Zachariah Weilenman, an interventional physical medicine and rehabilitation physician at Andrews Institute. Thank you so much for joining us today to talk about this.
Thanks for having me.
So first of all, what are the typical conservative treatments that you can try at home before taking the next steps and scheduling with a physician like you for this kind of spinal pain?
Sure. So, for anybody that develops some neck pain, the back pain that seems to just not be going away, first steps, you could just reach out to your primary doctor and make sure it's okay to take some gentle non-narcotic pain medications like Tylenol and NSAIDs. It may not get rid of the pain, but it might take the edge off of it. And I encourage people to just start moving, increasing activity. I tell people a lot, if you can walk half a block, you could walk a block, and then kind of build from there. And I think people would find that moving a little bit more seems to kind of help with sleep. You burn a little bit more energy and you sleep better, and that's sort of an overlooked part of chronic pain is poor sleep. I can't tell you how often, probably just about everybody that has chronic pain says it affects their sleep, and then sleep typically affects chronic pain.
Oh, it's kind of circular there.
Mm-hmm.
Well, what is the process for a workup to evaluate cervical or lumbar spine pain, and what is the timeline on that process?
So when I see a new patient that hasn't really had any kind of workup for a chronic neck or back pain complaint, the first things we typically do are order some basic x-rays of the area, just looking for any instability or arthritis, and I initiate a physical therapy treatment plan. Physical therapy is really the mainstay of treatment for chronic pain conditions. Most of what I do is supplemental to rehabilitating your injuries, and so we initiate the physical therapy. If people find that they're not really improving with physical therapy, then we move on to getting more advanced imaging, and we start talking about what kind of procedures I can do to try to help the pain.
Okay. So what is your process when determining if a patient is a good candidate for some of the outpatient procedures that you perform?
So, we obtain a history from them. They have patients describe what their pain feels like, where it is it shooting down the arms, down the legs? And I couple that with a pretty thorough physical examination, which physical examinations kind of aren't much of a thing in modern medicine anymore, but in my specialty in particular, we're very hands-on, very musculoskeletal, so I perform a pretty thorough exam when I see a new patient. And so, you take the history, you take the examination, and we look at imaging, and we take all of that together, and we try to figure out how I can help with procedures, with interventional procedures.
Okay, and can you elaborate a bit more on the outpatient procedures and what the success rate of those look like?
Yeah, so we like to say in our specialty that our procedures are diagnostic and therapeutic. So pain is a pretty tough thing to treat and identify exactly what's going on. So we're kind of taking our best guess as to what we think is the problem. And so when we do, which most of my procedures are needle-based injection type procedures, and a lot of times we're doing it to try to figure out what's the pain generator. But the thing is, when we do a procedure and we have the right target, it is the treatment in a lot of cases. So If we get the right target, then that's the treatment.
So it's kind of like you're narrowing down to your best idea of what is the origin of the pain, treating that. If that doesn't work, then it kind of tells you maybe it's something else that you need to be directing the treatment toward.
Exactly.
Okay, got it. So what are the methods of treatment that you use within your practice to alleviate pain?
So, most of the procedures I do kind of boil down into two categories. There are steroid injections that we typically use X-ray to guide needles into the spine and pretty much any joint that you need it in. And steroids are intended to try to calm down sort of chronic low-grade inflammation that is associated with arthritis. And then the other thing I typically do is nerve ablations, which the idea behind it is that, if you have a painful joint, a lot of times we have nerves that we can identify and we know how to place a needle next to them, and we can heat the needle tip up and basically cut off that pain signal from that joint where you can't perceive it. So the ablations are basically like cutting the wire that tells you have pain in that area.
That sounds very painful. Is that procedure painful, or?
I'd be lying if I told you it was completely painless, but typically we give you a little bit of light sedation, sort of, we like to call it twilight sedation, similar to like if you're getting a colonoscopy. And then we do numb the area before we go ahead and do it. And so we actually numb next to the nerve before we do the ablation as well. So typically it's very well tolerated.
Okay. So why did you choose to go into interventional physical medicine and rehabilitation?
So in medical school, I feel like people kind of go into a more of a hands-on or hands-off specialty. The surgical specialties are obviously very hands-on. I'm sort of a minimally invasive procedure specialty, but my background training is in physical medicine and rehabilitation, and that's a very hands-on specialty. And I kind of found through doing that residency that I really have a lot of empathy for people with injuries and chronic pain, and just recognize how debilitating it is. People just kind of affects every part of your life. And so I found it really rewarding that I could be in a specialty where I do these minimally invasive, quick procedures that often have like immediate and profound results. So it was very rewarding to me.
Excellent. And really quickly before we go, it seems like back pain and neck pain, they're kind of these things that everyone sort of deals with as they age, but how do you know when to go to a doctor for it? How do you know when it's just the aches and pains of life and when it's time to get treatment?
Yeah, I think, if it's lasted more than a few weeks, really come in and see me. You may not need to have any kind of procedures done, but maybe just the peace of mind of having somebody who deals with this all day, every day, be able to tell you what you should and should not be concerned about, will kind of give your mind some rest on the issue. And I can at least give you some guidance as to how you should proceed with the chronic pain. So typically if it's lasting more than a few weeks or months, let's get a little more aggressive and start trying to treat it.
Okay. Well, thank you so much for sharing this with us today.
Yeah, you're welcome. Thank you for having me.
Coming up, class is back in session. We're exploring the offerings at UWF's Leisure Learning Program. Stay tuned.
If you're looking for a fun and exciting environment for your loved one, then L&L Executive Adult Daycare is a perfect fit. We offer social gatherings, physical activities, games, outings, and daily luncheons from Karen's Catering. We take a holistic approach to social stimulation and aim to enrich the lives of our guests. Let us help restore your loved one's mind, body, and soul. We'd love to speak to you. L&L Executive Adult Daycare. Big business love with small town feel.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram or go to aaflorida.org/volunteer.
The Beacon at Gulf Breeze offers the finest senior living community in the area. We are here for your loved ones who need assisted living and advanced memory care services. Seniors will feel right at home with studio, one-bedroom apartments, a large dining area, a beautiful landscape courtyard, and even a salon. With professional staff and one-on-one care, your loved ones are our top priority. Welcome to the Beacon at Gulf Breeze. Welcome home.
To Sofia and Gabriel, mis flores, my little flowers. Even though these old knees can't follow on your adventure to the forest today, these flowers represent my love, so you can take me with you wherever you go, near or far. These stitches and threads join us together. Me, your mother, and both of you. And wherever you see a flower, a bird, a beautiful tree, know that my love is with you as you bring our colorful stories to the world.
Make the forest part of your story.
Learning new skills, visiting interesting local places, and attending educational lectures are all ways to stay socially and mentally engaged as we age, and they're all things you can do through the Leisure Learning Program at the University of West Florida. The program offers lifelong learners aged 55 and up the opportunity to explore new ideas, skills, and locations with a spirited group of peers. We've got Valerie Taylor and Julie Still-Rolin here to tell us more about the program and upcoming offerings. Thank you both for being here today.
Thank you for having us.
So first, tell me each of your roles in the Continuing Education Department and what you do there.
Yeah, so I'm the Associate Director for our community programs. So that includes our Leisure Learning Program that we're here talking about today. I also oversee our youth program for our summer camps, as well as other personal enrichment programs for a variety of ages.
And I am the Director of Leisure Learning. I just started about 2 months ago, and I get to plan and coordinate the tours and classes that we're talking about.
Awesome. So tell me about the Leisure Learning Program and how the kind of membership structure works.
Yeah, so membership is open to anyone who is 55 and older. All it is it's a yearly fee of $40, and that allows you to register for any class. There's some additional university benefits to that, like being able to use the library, things like that. But really, the ideas of a membership is that this is a group of like-minded individuals who want to take classes, who want to keep growing, who want to keep learning. And so it allows them to also see each other at classes throughout the year, get to know each other, build relationships and friendships outside of just the regular classes.
So they kind of form a cohort of sorts?
Absolutely, yes. And we have about 300 members right now.
Oh, wow. Mm-hmm. And then you pay that fee, and then it's very affordable to register for the individual kind of events and classes, right?
Yeah. Every class has its own fee. Most are about $15. Mm-hmm. And we'd offer about 60 to 70 classes each semester, and we have 3 semesters a year.
Okay. So what are some of the upcoming offerings for the next semester in the spring?
So we have over 70 classes planned. They range from, we have some really good cooking classes, like we're going to do some cookie making at Crazula's, and then Bodacious is offering a charcuterie board class. We also have some really good lecture series ranging from topics of like art and history to current affairs and finance. We even have a CPR class and a magic class.
Oh, wow.
I wish I could name them all, but I don't think we have enough time.
Yeah, with 70 classes, I don't think we have the time. But I love that it's kind of a mix of these kind of more classroom lecture type series, and then also these adventures that you get to go on, and the cooking classes sound amazing. So I know you have classes and also the tours of different areas, so tell me about some of the tour locations and how you pick those.
So one of the locations coming up is the new Baptist Hospital campus, and one of the students suggested that one, and I thought that would be really neat to include. We're also going to the Old Sacred Heart Hospital. They were very interested in that as well. We get to go with Robin Richard to Belmont de Villiers and do a tour over there of that neighborhood. And the W.R. Taylor Company building, which is an unusual and historic building here as well.
Okay, awesome. So I know people can obviously register and become a student, but what are some of the other ways people can get involved in the leisure learning program?
Yeah, absolutely. How she said, like a student recommended, one of our members recommended a class. We have our members, we really value their input. So they have various ways they can get involved. They can become, once you're a member, if you would like to become a liaison, that kind of just means you represent the class, you check everyone in. We have a curriculum council that's made up of some members. Those are people who want to help set up classes, contribute to the ideas. But outside of membership, open to anyone is being an instructor for a class. It can be a business that's interested in having our group come see them, do the tour. It could just be a person who has an interest in a specific area. And of course, we have our UWF faculty and staff who often contribute by doing a lecture on a topic that is their interest.
Okay, so other ways people can get involved in the community. Tell me about what have some of the popular things that have been done in maybe this last semester that you got a lot of great feedback about.
Yeah, one of the big things we just talked about before the show is the Port of Pensacola. That was our first class that filled up right away. Everybody wanted to go see it. And it was very interesting. Another one that was popular, the class you just had this week, Holiday Hauntings.
Yes, Holiday Hauntings. So ghost stories that you can tell at Christmas time.
Oh, scary ghost stories and tales of the glory, of course. That's awesome. Is there anything else people should know about leisure learning?
That we're always accepting members, and we are happy to have them, and I think it's really important that we all stay lifelong learners and that we all continue our growth and our education. And this is a way to do it that's fun and it's low stakes. You go to one class for an hour and a half, and we're a welcoming environment.
So no one's going to get, an F on their report card for coming to these classes.
No
obviously.
report card, no homework.
That's awesome. That makes it very appealing, I'm sure. What do you find that people get out of it? And we're talking about our aging community. It's keeping them involved. What are they getting out of all of this?
I think that's what they're getting out of it is they're getting time to get out of the house, be social, use their brains, be active physically, mentally, socially. And I think often as we age, our networks can shrink. That's a very natural thing. And so this is a way for your network to grow, and really that's just such a benefit to all of us.
Absolutely. Thank you both so much for being here and telling us more about the program.
Thank you for having us.
Stay tuned. We've got a holiday-themed craft demonstration with our friend Kenny Holt coming up next.
Over 2 decades ago, TLC Caregivers partnered with the Council on Aging of West Florida to assist seniors with non-medical help to stay independent in their own homes. Our commitment to providing these services started in 1989 and has grown to aid people from birth through geriatrics, from a short visit of 2 hours to 24 hours a day. We're a proud sponsor of the Council on Aging of West Florida. We're TLC Caregivers.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
Me and my boy Matt had it good. He had catnip that was off the hook. But one day, he brings a girl home, and she's allergic to cats. Every sneeze was a nail in my coffin. Now I'm in a shelter. It's decent, but they don't even have Wi-Fi.
Life doesn't always give you time to change the outcome. Prediabetes does. One in 3 adults has prediabetes, and you could be one of them. There are usually no signs for prediabetes, so it's important to understand your risk. With early diagnosis, prediabetes can be reversed, and you can change the outcome. Take the 1-minute prediabetes risk test today. Go to doihaveprediabetes.org.
Tis the season for crafting, and today we're joined by Kenny Holt of TLC Caregivers, who is here to walk us through the creative process and give us ideas for handmade ornaments for holiday crafts. Thanks for being here today, Kenny.
So glad to be here. Thank you.
So tell us about what we got today. What are some ideas to get the creative juices flowing for some holiday ornament crafts?
Well, our idea is ornaments today. They don't have to be for the holidays. People can create crafts around their favorite mascot with college or pro. Of course, we always think of ornaments for Christmas because we do use them on a tree. Mm-hmm. But ornaments can be used anywhere. And like TLC with our activities program, we say be creative, have fun, just do what you want to.
Yeah.
And sometimes that's very simple. You can craft with beads. You can craft with just about anything. This one is a drawer handle. And I thought, what a neat idea to make that into something that I like and display it within our house. Mm-hmm. So these here and a couple of these are just wood cuttings from a limb. These cost 99 cents. These were a little bit more. But you can be inexpensive in creating these. Sure. People can paint, draw, use markers. I use Sharpies a lot. That's what's on these. Some of these came with a design on them, and you can decorate that design, or in the case of different ones, you can draw them. And I think everybody can draw. You don't have to be a full-on artist.
Sure.
I think everybody can draw.
And these little woodcuts, that's something you can get at any craft store, yes, dollar store kind of thing. They're very, I know I've seen them at a lot of different places. And then you just take your ideas and go from there.
Yes. Mm-hmm. Also, I use this one as an example. You can take a card that you've received that means something to you, or one that you just like, and you can cut out and create your ornament.
Oh, I love that. That's a great way to reuse, the Christmas, yes, cards we get with the beautiful family pictures of our friends. You
yes,
want to save it, turn it into
and you
ornament.
Can find, you speak of pictures, you can find ornaments that you can incorporate your family portrait or a grandchild or your pet.
Sure.
That's one of them I used here with paw prints. Mm-hmm. Also, it's not a photograph, but it means my pet. I did not do this one, but I thought it was appropriate for the season, mm-hmm, and I liked it, so I did include it.
On the crab, very coastal Pensacola.
And it says Bah Humbug. I don't know if you can see that over there or not, but I just thought it was very cool. Mm-hmm. I wanted to create a gnome, pine cone gnome, and you can buy the material for his hair and beard. This season you can do small Christmas hats, or I chose not to do a Christmas hat. And I have thick cotton swabs that I used for his feet and arms and hands. So really it's whatever you like, whatever you want to do. Like I said, be crafty, be creative, and have fun. That's what it's all about, and it means something to you.
Absolutely, and I think that's a great way to use the kind of objects that you have around your home, yes, in a creative way. Make it sustainable, give it as a gift that is handmade and really thoughtful, and has that little piece of you in it.
Yes, and I always think that's vital to anything, art, crafts that we do. It really has to mean something to you. Mm-hmm. And that's why I say ornaments don't have to be holiday related. Find something that you like
Oh, yeah.
and would like to be around all year.
And I know that people now do Halloween trees. That's become a
Yes.
big thing, so you can always make the ornaments for that. But yeah, I think, for any holiday or for any kind of area of your house where there's somewhere where you can just hang a little something, you could make an ornament for that.
And you can be as elaborate as you want, or some of these just took minutes to make. Others, with drawing and coloring and designing, may take a little bit longer. If you're crafty in needlepoint or anything like that, you can make those into it too. Now, of course, that's going to take more time. But again, do what you want. Do what you like. Do something that means something to you.
I know I like to sew little felt ornaments, and I started teaching my daughter how to sew a little bit with that. So these are the sorts of things you can do with the whole family, whether that's with a child, whether that's with an older adult in your life, a parent. And you can get everyone together to do it as kind of a family activity.
Absolutely. I'm glad you brought up children, because my granddaughter, her name's Raider, we took this and cut it out and put her name on it, and she's going to love it.
Yeah, and then she can see that, there's my name on the tree. So you just got little letters that you can take out and stick onto. Yeah.
That's why I say you can use stickers. These are letters that I found that you can just take them off. The gnome that I used here for the loved one, he's not even a sticker. It's a card cut out and glued on.
I love that, the use of greeting cards, because you get the greeting cards, you want to keep it, you keep it for a certain amount of time, but then you're trying to declutter. But this is a great way to kind of save the beautiful card, the beautiful picture that you received, and turn it into something that you're going to use again and again.
And it still means something to you, and now it has a new meaning.
Absolutely. I love it.
Making memories.
Perfect, and preserving the memories. Anything else you want to say as far as ideas for crafting ornaments, holiday decor?
I think that people can make up their own minds on what they want to do, and like I said, be crafty, be creative, have fun, use basic items, and create something that means something to you.
Love it. That's a great message for the holidays and for all year round, like you said. Thank you for watching. Until next time, enjoy life. You've earned it.